Good afternoon, everyone. Thanks for joining us on our media briefing for this Friday. We're going to get started with our colleagues from the Dolan Fire, who are going to give an update on what is happening at the fire and the fire camp this morning. Good morning or good afternoon.
Good afternoon, everybody. My name is Chris Barth. I'm a public information officer with Pacific Northwest Team 2 on the Dolan Fire. Just a quick synopsis of the current stats for the fire. On Friday, September 18th, we're at 127,724 acres. We have 45% containment today, and we are at 732 personnel assigned to the fire. With that, I'm going to introduce Rob Allen, our incident commander, who's going to talk about the fire, and I'm going to show the map on the screen as we go through the different areas.
Yeah, good afternoon, everybody. Nice to talk to you again. Rob Allen, Incident Commander here with Dolan Fire and Pacific Northwest Team 2. Our map is starting to get filled in with some of the black lines that we all like to see. That area from Big Sur all the way down to Lucia. We have in a patrol status, and we're working on pulling equipment out of there and trying to secure that up as much as we can. So we can get folks back to life as near normal as we can get that. From Lucia down to Pacific Valley, we're still finishing up burning off in that area there. We've finished working around all of the homes and brought fire down to the road. And you can see the black is starting to fill in there to secure that onto Highway 1. And with some good weather here and the marine layer staying out a little bit, we're hoping to get that wrapped up here in the next couple of days and then be able to put that into patrol status also. Our big improvement since the last time we talked is that section of line from Highway 1 up and over to Fort Hunter Liggett. That was a couple of roads and some dozer line that we pieced together there. We got that all burned out about a day ago, and we're holding that line now. It's looking really good. We've had a few spots across. We've been able to pick them up, and now we've been working the last 2 days to just make that line a little bit deeper and getting that into good shape. So we're feeling pretty good about our southern progress of the fire. Coming around through Fort Hunter Liggett and then up to the old Indian Fire Scar, that area there. We've controlled quite a bit of that, but some of it still, because of the unexploded ordnance that's around there, we can't really leave the road. So a lot of that's just monitoring and keeping track of what is in place there. We keep moving farther up to the north, and we've got a long section of road that we opened up to get up to one of our repeater sites in there that's been holding, and we're feeling pretty good about that one. And then we got that northern end where we've been working closely with CAL FIRE to secure structures in the Arroyo Seco area, as well as out to Tasajara, and bedding those dozer lines in shape and structure protection in place. We've got a firing operation planned if that fire starts to move again. But what we've been relying on lately is a lot of aircraft to keep that fire in check up there and keep it from advancing towards Arroyo Seco. And as we work on that process there, with the limited resources we have, crews and engines that are being used on other fires or being asked to respond to other fires in the state, we keep trying to put together a plan there that'll help us tie that fire in from Arroyo Seco over to the old Sobrantes fire. And that's our next kind of big step, trying to push in on that as we're wrapping things up on the southern end. We can shift crews around to the northern end and start working on that piece up there. We have daily conversations with the Sheriff's Department, Caltrans, CHP on what sections of road and we can open and what sections we still need to keep closed for firefighter and public safety, as well as looking at every day kind of evaluating where we are with warnings and closures and evacuations so that we can update those as we feel confident we can let people back in. That's what we've been working on lately. Kind of the big news for us after yesterday, we did move our incident command post from Big Sur over to King City so that we can better be in touch with the folks that we're working with over here, our partners and our resources that are now focused really on this east side and particularly up in the Arroyo Seco area. That's kind of it for our update for today. Appreciate the opportunity to chat with you all today, and we'll be open for questions for a little bit.
Thank you very much. And I actually already have a question for you. And for those who may not have seen the outreach, we're going to take questions about the Dolan Fire right now, and but because these guys have got to get back to it. So our first question, are there more structures anticipated than the 19 or so reported that have been destroyed as a result of this fire?
Yeah, at this point, I think we've gone through and done all of the assessments that we need to, at least in the areas that we know. There is potential that we'll find stuff out there maybe that we didn't know about beforehand, but I think that number is pretty solid right now as far as the investigations and the search that we've done to this point. Thank
you. That was the only question that I had for you right now. Is there anyone who has a question for our Dolan Fire folks before they have to get off the line, either in chat or just asking a question? Not hearing or seeing. Thank you both. Wait, hold on. Here's one. Are mudslides going to be a concern in the aftermath of this fire?
Yeah, they certainly are. And if you've, for those folks that have been up and down Highway 1, Caltrans has already been out there looking at culverts and looking at drainages and starting to do some work. What will come next for us, we've got two processes that we'll work through on the fire itself. We'll do repair work on stuff that we have damaged. The dozer lines that we've put in, we'll eventually come back in and work to secure those up so that they won't be a problem, or will be less of a problem. Right now, we're kind of limited on the amount of work that we can do for that repair work, as most equipment and resources that can fight fire need to be out fighting fire, and then we'll come back and do that later. The second step, and we were talking with them just yesterday, is a burned area emergency response team, and that'll be set up by the forest. They'll come in and start really looking at those areas that need to be either seeded or more work done to protect from erosion in other areas. And they are starting to form now. They bring a whole team of specialists in that'll go out and look at the soil, look at the water drainages, look at a lot of things that they need to pull together to try to do that. And that team will be starting to form here. And we've talked to them about being able to, on that northern end, probably safe enough for them to get in around Big Sur and start working sometime in the middle of next week.
All right, thank you. I don't have any other questions. Chris, I know you like to usually wrap up and kind of share any upcoming virtual meetings or information. Why don't you go ahead and do that?
Thank you so much. Again, it's great timing. We do have a virtual public meeting this afternoon at 2 p.m. It's going to be on the Los Padres National Forest Facebook page, as it has been. So we really encourage folks to either tune in live and ask questions there, or you can watch a recorded version of it later when you have time and at some point later. We do, again, as always, remind folks that we have information posted on IntiWeb and Twitter as well. And again, I just want to put a plug for the Los Padres National Forest Facebook page, because we've been doing a lot of great visual storytelling, I feel, about the work that's being done out on the ground, and as well as the why and how it's being done out there. So I encourage you to tune in and check out some of that and see the story of how the firefighters are working to handle this fire.
Thank you. And I know I'm really enjoying your visual storytelling on the fire. All right, thanks very much. We'll let you get back to it. We're going to move on. Once you have a fire, then you have recovery. So we're very pleased to be joined by Steve Kalanog with the EPA. He is an incident commander for these 2020 wildfires, and he's going to talk about phase 1 of debris removal, which is a very important step for those impacted by the fire who've had homes lost or damage. Hi, Steve. Thanks for joining us.
Hi, good morning. Thanks for having me and my colleague, Rusty, our public affairs officer. Good afternoon, everybody. My name is Steve Kalanog again, and I am EPA's incident commander for the phase 1, which is the first phase of the post-fire debris removal process. In the aftermath of the fire, the first work that needs to be done is to remove any household hazardous waste and hazardous materials that may have been released as a result of the fire, destroying residents and other structures in its wake. We need to do this in advance of the larger debris removal activities, which we traditionally call here in California Phase 2, in order to remove those hazards for those debris, Phase 2 debris workers. And we're being tasked by FEMA at the request of counties, and in this case, Monterey County has made the request to Cal OES, who has in turn discussed this with FEMA, and they've tasked us to do this work. And we've been doing this now for several years now, and I've led the EPA's responses up in the Camp Fire in Paradise and Southern California and North Bay fires in previous years. What our teams do is go out and typically you will, if you are out in the impacted area, you'll see our teams in Tyvek with those white suits and respirators. We will have field monitoring equipment, assessing the damaged properties, make sure there's no immediate risk due to a variety of different potential constituents that may be leaking from containers and what have you. We're going to collect those and remove those from the burn impact area, whether it's the home, primary residence, or outbuildings. And we're going to take those wastes off site. Depending on the size of the property, that can take a few hours, or in some cases, it can take a day or more. Those household hazardous waste materials can be things like traditional household cleaners, your bleaches, solvents, what have you. Can be paints, degreasers, car batteries like that. And there are residents and that have hobbies that they may use things like compressed gas cylinders, like acetylene torches for welding or other purposes that may be compromised that pose a risk to the community as well. We'll take those out. Some cases there may be small above ground storage tanks for fueling tractors or things like that. We'll assess the property and remove those items. And once we're done, we will notify the resident by letter and through the county. In addition, we will have a public-facing website where communities at large can see our progress, where our teams are working, and they can gauge the status of each individual property. And lastly, just to be sure, we'll stake a placard. It almost looks like a small billboard in the front of the house. It's actually only 8 by 11 that says that the EPA's been here and the Phase 1 is complete. If you had any questions on what was removed, we note complete inventory of the materials that we take off in case you were interested to find out what was removed from your property. And at that point, that property is now eligible for the Phase 2 process. We work very closely with county agencies, and in this case, Monterey County and the local jurisdictions. In addition to the county environmental health, we work very closely with county sheriff. If there are any concerns that we need to coordinate with them on, and there are a variety of those things as well. We work with planning and public works as well in the county offices. You know, the artwork is always challenging, and it's made a little bit more challenging this year. Well, a lot more challenging this year due to the pandemic. And we are implementing a wide variety of measures to ensure the communities are working and are safe. And that will include a whole host of preventative and monitoring tools for our teams to make sure we're not creating or bringing in a problem to the communities we're working in. And it's also to ensure the safety of our teams as well. So I wanted just to put that out there, that we are very mindful of the current pandemic conditions and are working to mitigate those to the greatest extent possible. Hopefully in the upcoming presentations that we have here, we'll be able to put our website up here shortly. I think by next week it will be on the county's page if it isn't already. And then we can talk specifics, and I can show you pictures of the actual properties we're on. We are anticipating beginning work in Monterey week after next. We're establishing a larger command post and staging area up in Santa Cruz. We will be working on damaged properties in Monterey that are the result of all three fires, the Dolan, Carmel Valley, and River fires. So as you all know, that covers quite a bit of the county. So our teams will be all over out there. And with that, that's a general overview of what we are going to be doing in the coming days and weeks. And I'm available for questions if you have any.
Thank you very much. That was a wonderful overview of the work. I think a lot of people are wondering, what is phase one? What is phase two? So this was a great tutorial on that. Are there any questions for Steve? We only have him for a limited time, so now would be a good time to send me some questions. I'll start with one and see if anybody else chimes in. I know a lot of people who are returning to their homes are wondering what should they do when they return to their homes? What's the best way to recover? Say they're looking for a keepsake or a memento and they see it there in their home site. What's the best way for them to manage that and then still be eligible for this assistance in debris removal?
Sure, I'm glad you asked that question, and it happens. It does happen every year where residents want to go up and view their properties and try to recover valuables and heirlooms and what have you. First off, in discussions with the county, to the greatest extent possible, both EPA and the county highly recommend to minimize the disturbance of the fire debris to the extent you can. If you are going to go up to your property, is to wear a mask to prevent the inhalation of potentially dangerous particles, safety goggles, gloves, heavy boots. There are lots of nails of broken glass and other sharps that one could step on. And take care not to significantly disturb the ash and cause particles to get airborne. Now, certainly you're looking for certain items. We discourage trying to sift through it at this point. Our teams are mindful of the fact that they will come across valuables, and that is one of the reasons we work with local law enforcement. When our teams find what we assume to be or perceive to be valuables, we'll immediately notify the local, in this case in Monterey, the sheriff, who will then endeavor to contact the property owner that we have found things like jewelry or things like that, and endeavor to get that back to the property owners as quickly as possible.
Thank you for that. And then I have another question here. What happens in phase two?
Well, phase two generally is the larger fire debris removal. So those are where while we do use some heavy equipment, small excavators and what we call what are called skid steers, small, basically bulldozers, front end loaders. The phase two brings in the larger equipment, your bigger excavators and things like that. And they're picking up all fire damage debris and hauling that off for disposal. That is their goal is to remove the impacts of the fire and basically put the property in position where it can be restored and rehabilitated. So often down to the foundation. Who's going to do it is still being discussed right now. Done in years past, it's typically done by Cal Recycle. Sometimes it has been done by the U.S. Army Corps of Engineers. I don't know specifically who's going to be doing that yet, though just before I got on this, I was on a call with Cal OES, who assured county officials that they will be able to give them clear direction on who's doing phase 2 in the coming days.
Thank you. Another question for you, is larger debris taken to local landfills?
Yeah. So all phase 1 debris gets segregated and disposed of at an appropriate hazardous waste landfill. And all phase 2 debris will go to traditional construction demolition debris landfills. And it's often determined which ones due to capacity limits. So they work very closely with the county landfill folks.
And then where is the hazardous waste taken?
Again, the hazardous waste is taken to hazardous waste disposal and treatment facilities. And depending on the quantity and the types of hazardous waste, we send it to the appropriate disposal facility, and that can be any of the haz waste facilities throughout the West Coast.
All right, thank you. Are there any other questions for Steve before he has to step away from our briefing? Give it a second here for any questions. We have no more. Thank you very much, Steve, for giving us just a really great overview of phase 1 and phase 2.
Thank you.
Thank you. All right. And now we're going to move to the topic of COVID, and we're joined by Dr. Moreno, who's going to give us an update on COVID information and hopefully even answer some questions on the school waiver process.
Good morning or good afternoon, Mia. I'll give that update right now, but I also wanted to point out that we have an announcement that we want to make from the health department about our annual flu vaccine clinics. And I thought maybe Karen Smith could jump into that first, if that's okay with you.
Certainly. Take it away, Karen.
Okay, so I've shared my screen. We've announced the flu clinics, and this year it's in, Dr. Moreno will probably talk about this as well. This year it is incredibly important that people get their flu shot. Not only are they both respiratory diseases, which is a problem in diagnostics, but we want to also keep the pressure off of the healthcare providers in the hospitals. And as you know, that every year many people are hospitalized with flu. So starting October 10th, these are with partnerships with the hospitals. There will be no cost flu clinics throughout the county. So right now there's 9 scheduled. There's still some details to be worked out towards the end. So, and this is available on our website. I'll put the link in the chat box. And that's it for me.
Thanks, Karen. I'd also want to point out that employees of Monterey County businesses should also check with their employers to see if they've made arrangements for flu vaccine clinics or access to flu vaccine. So that's also another opportunity. And of course, people can see their own physician or the healthcare provider to receive the flu vaccine and check to make sure that you're eligible and that there's no contraindication to a flu vaccine, receiving the flu vaccine. And then finally, there are also our pharmacy providers who can provide the flu vaccine to most customers. So thank you very much, Karen. Let's see, so I'll go ahead and move on to COVID, and I'll share my screen now, if that's okay. Oh, Karen, can you stop sharing? Thanks. All right, so let's see if I get this. Okay, so Maya, can you see the title slide for this presentation?
Sure can.
Okay, so some of you may have seen this if you were on the Tuesday board briefing, board presentation, but I'll try to go quickly through it. So just, I want to share our Epi Curve. This is, these bars represent weeks during our COVID pandemic. And what we have here is, hopefully you can see the cursor here. You can see that early in the pandemic here in Monterey County, we had a relatively flat curve. That was when we were under the local shelter-in-place orders. We then, around this time, aligned with the state and a lot of other counties, and started following state guidance, moving through the various stages of the COVID response. And so that partly explains why we had an increase in transmission, or increase in number of cases due to increased transmission. We also had, during this entire time, we did have an increase in testing accessibility as more laboratories were approved by the state to conduct testing, and more providers were able to build up their PPE and protect their employees to thus offer to collect specimens and offer testing for COVID-19. So there's a variety of factors going on, but overall we did have an increase, and then we leveled off here. And over the last 5 weeks, we have seen a decrease. It was probably a couple weeks ago that we saw this initial decline, and it was probably too early to say that there's a trend, but now we have a couple more weeks, and it appears that there may be a slowdown in trend, a decrease in daily and weekly case numbers here in Monterey County, which may indicate be due to a couple things. One is maybe due to a decrease in transmission of the virus here in Monterey County. And also we know that there's a decrease in testing rates in Monterey County and in most counties in California. There are also other counties sharing that they're experiencing a decrease in testing rates in their communities. This is a graph of our hospitalization census. A census is a count of how many people with COVID-19 are in a hospital bed. And so similar to the previous slide, we had a somewhat level, slowly increasing a somewhat level hospitalization rate due to COVID-19. And at this time, hospitals were still deferring elective surgeries and procedures to make sure that we had beds available. And then we did start seeing, as the case rates went up, the number of people in the hospitals in Monterey County with COVID-19 also went up, but it also stabilized over several weeks. And consistent or concurrent with the decrease in case rates, we also are now experiencing a decrease of a number of people in our 4 hospitals with COVID-19. And over the last couple of weeks, it seems maybe leveling off to a new level. And this is something else that we're interested in here locally, and that is making sure that we have intensive care beds available for any of us here in the county that might need that level of care. Having ICU beds available means that if one of us needs to be in an ICU bed, we're more likely to be able to stay here in one of our hospitals and not have to be transported to a hospital in another county. We did have this shows on the left what percentage of our ICU beds here in Monterey County are available should we need them. And we had about 70% of our ICU beds available for quite some time. And then we did see a dip. So a dip in availability means that the ICU beds are filling up. So back in August, we got down to 10 and 20% of our beds were open, meaning we were almost full. And since then, with the decrease in rates that we've been seeing and decrease in hospital census, our ICU beds, people are being released from the ICU beds, and they're not being refilled as quickly, which means that we're getting more and more empty beds. So now we have about half of our beds are once again available for in case we need them. This is something that we are putting on our webpage. It's the testing rates in Monterey County, and the red zip codes, the red regions by zip code, show where we have the lowest testing rates in Monterey County, and then followed by the orange, yellow, and then finally the green regions, which are regions where we have the highest testing rates. So our highest testing rates right now are primarily in our Salinas Valley area. And so we do look at this map and update this map for help providing information and helping to inform us of in terms of deciding where and how we work with our partnering agencies to improve testing availability in those communities that may not have high testing rates, and try to encourage testing for those people who should be tested for COVID-19. And this slide shows that there's two curves on this from plotted data. The first is the blue curve. We have 4 data points, and this is our case rate, the number of cases we have per 100,000 individuals in Monterey County. And our case rate has been decreasing, and we do have down to 13.9, which means that we can get, the schools can now submit applications for a waiver of the state requirement to keep children out of classrooms for in-person instruction. That's because we're now below the case rate of 14, and at 13.9 we can receive waivers. So we will be reviewing any and all waivers that come into the county, and then if the process is that if given our circumstances in Monterey County, if I believe that those waivers should be approved, I can make that recommendation to the California Department of Public Health, who will consult, and when they're consulting, they will also on their webpage post the schools that are requesting waivers here in California. So that's a place where the public can go to see which schools are officially being considered by the state. So the state has to consult in order for that, and approve in order for that to happen. So when the state posts that, that's when it's gotten to a point that it's being under final consideration. The second graph here, or curve here, has 4 data points as well. That's our positivity rate, and our positivity rate has been declining as well, and we are at 9.8 now, and that's again averaged over 7 days. And whether or not schools can provide in-person instruction is not dependent upon the positivity rate, but whether or not counties can move into, or Monterey County can move from tier 1 to tier 2 in the state's blueprint, which is based on a tiered framework, is dependent upon our case rate getting below 8%. And so as you can see, we're making some progress in our positivity rate. It is slowly decreasing, and we will wait to see what our positivity rate is according to the state formulas next Tuesday, when the California Department of Public Health posts both the adjusted case rate and the positivity rate for our county and for other counties as well. One more thing I want to point out, and that is not only does the positivity rate need to drop down below 8% for us as a county to move into tier 2, but the case rate must also drop. If we were to follow this trend, if it continues, we need to drop below a case rate here of 7.0. So that both must occur. The California, what I want to share, Maya, is also that we continue to have conversations. I say we, it's health directors and health officers for the counties continue to have weekly conversations with the California Department of Public Health, as we have for months now, where we give feedback to the state on how this is the state's guidance and requirements are being implemented, how they're being received, and here at the local level. So we'll continue to do that and inform the state of how things are going here under this new tiered framework. And then finally, the point I want to make with this one slide, May, is that we've already, we'll be considering some waivers from schools for in-person instruction, but that's just part of the loosening of restrictions. The other major big part of that is the hopefully loosening of restrictions for our business sectors. So in order to move to tier 2, the state has made it clear that at this time, counties need to reduce their case rate and their positivity rate to the levels that I described just a minute ago. In order to reduce our case rate and our positivity rate, we need to reduce transmission, further reduce transmission of COVID-19 in our county. And in order to reduce viral transmission, we have to, as a county, continue to implement infection prevention measures such as physical distancing, wearing face coverings, washing our hands frequently, staying home if we're sick, or if we're a contact to someone who has COVID-19. If people are ill, they very much are encouraged to seek or consult their health provider to determine if they should be seen, evaluated, and or tested. And there are certain people who've been exposed to COVID-19 who should be tested as well. So that's still important that people get tested. Also, in order to slow the transmission, we have to identify people who have COVID-19 and make sure they understand steps they need to take to not expose more people. And that's, in order to do that, healthcare providers are still encouraged to make that initial recommendation to someone who calls them or visits them with COVID symptoms, whether they have a positive test or they are waiting for the test result. They should still be told to isolate themselves until the test results are back. Anyone who has a positive test result that we have contact information for that's provided to us from the healthcare provider or the laboratories, we are continuing to call them and explain to them why, how to isolate and the importance of isolation. So it's really important that anyone who's testing positive, they get a call from someone who identifies themselves as from with the public health here at the health department. Please work with us so that we can work together to continue to slow the spread of the virus. And finally, if you're a business out there and you're in tier 1, you're allowed to operate with some restrictions. Please continue to follow the business guidance. If you're a customer, please be respectful of the business's efforts to try to follow guidance and reduce the spread so we can get from tier 1 to tier 2. And schools will definitely need, any schools that are following state guidance will need to continue following the state guidance and in respect to checking for employees or students who may have symptoms and keeping them out of the school when kids go back to school, and being able to appropriately use face coverings and keeping distance between the teachers and the students. So that these are all things we still need to do in order to slow the spread, which will reduce our case rate and positivity rate, which can get us closer to moving from tier 1 to tier 2. So I'll go ahead and I think I'll stop there for now and hand it back to you.
All right, thank you very much. And I've got some questions already lined up for you, so let's get started. Is test frequency declining to the point that the state might consider moving or removing the Greenfield test site?
Thank you. So the test, we're following testing rates throughout the county, and I think just to provide a little clarity, the state is providing the testing, but the state is primarily depending upon us, the locals, to determine where the best use is. We do need to contact the state to get approval to move, but I don't have a specific answer for that question, but I would like to say that we are looking at testing rates, and we do want to make the best use of all of our testing sites. So, and the reason we want to do that is because we do not want to allow the state any reason to remove one of our test sites to give to another county who might be able to make better use of it. So we're looking at testing rates, and we will, if necessary, we will need to make adjustments to not just our optimum surface testing sites, but also working with our some of our partner agencies to identify places where we can have temporary strategic testing sites throughout the county.
All right. Another question for you. At what point might youth sports be allowed to resume with modifications?
So right now, what we have available to youth sports organizers are guidance from documents from the state that allow those organizers to provide some level of sport conditioning and training. We would need to, as far as loosening those restrictions, we would have to meet state criteria and the state would have to allow those type of youth sports. But for now, that's what we have available to us. And the only actual sports that allow actually the game itself, the competition to occur are that I know are the professional sports. And so we do have some professional sports planning that's going on and events that are going on. Here in Monterey County, I believe it's primarily, just one example would be golf, professional golf tournaments where the golfers in their professional capacity are allowed to compete with one another without spectators. And that's what we have available for now.
All right. And another question, what is your advice about Halloween trick-or-treating this year?
So we're still, thank you, and appreciate everyone's patience on this. There's already guidance coming out from some counties on this, and at this time we're looking at what some of the counties are recommending and not allowing and supporting. And we're also working with the state on this, and we've had a couple of meetings now with California Department of Public Health, looking at possibly some statewide guidance that we and other counties would be able to support. But in generally speaking, I can just say for now that we do have some concern about the challenges that we would have with trick-or-treating in terms of keeping 6 feet of distance between trick-or-treaters and the various households. And so that's a challenge that we recognize. But we're also looking at maybe just suggesting other additional ways to celebrate Halloween this year that would create greater distance. And just the basic principle there is that the more distance we can keep between households, the better we'll be in reducing a transmission. So, so I'm hoping that we can have something out soon as the state and counties like ours get closer to some consensus of what we think makes most sense and is most effective in continuing to slow the spread of the virus, but also most supportive of families celebrating holidays like Halloween.
Right. Another question, based on positivity and case rate trends, do you anticipate being in that next tier of reopening by November?
So thank you, Maya. So on this one, I can't anticipate when we would get into that tier. I would just like to point out a couple of things. One is that this virus has been, or this pandemic has had its moments when it's changing and unpredictable, but we've done our best to plan and implement strategies that we believe are effective at slowing down the virus. The other thing that we don't have, or that we have seen, is that as the pandemic continues to evolve, the state of California has modified metrics and criteria for tightening or loosening restrictions. So between now and, well, in the months ahead, could still be some changes in the manner in which the state guides counties through this pandemic to simultaneously slow the spread, but also try to encourage opportunities for our businesses reopen. So there's some uncertainty there as to what lies ahead as well. So uncertainties of the pandemic, uncertainties of future requirements of the state, and then finally we will be entering into flu season shortly. Flu vaccine is already available, so people should seek out the flu vaccine. But as we get into November and December and January, we're going to have another flu season, and so we may not be able to anticipate exactly how the transmission of flu virus interacts with transmission of COVID-19 virus. And so there's some uncertainty there. So it's really challenging to try to anticipate what's going to happen, which is why we have to continue to plan with strategies that we have control over. So I'll just end with one is we need to continue to practice these measures to reduce the transmission of the virus, but also we really need to get people to get vaccinated with the flu virus. If we can get as many people as possible vaccinated and protected against flu, I think the impact of the interaction of flu virus transmission and COVID-19 viral transmission may be reduced enough that we hopefully will not see some significant detrimental impact from interaction of the transmission of two viruses at once.
All right, thank you. And our last question here, what are the current recommendations on who should get tested?
We have, thank you. That's a good question. I'd have to go back and look at the guidance. There is guidance that we're still following that CDPH has put out, the most recently revised guidance. I think best I could do right now is maybe get that link and have you share it with people. But we are definitely in Monterey County at this time still following the state's recommendation for prioritization of testing.
All right, thank you. That's all the questions that I have in chat right now. Are there any additional questions for Dr. Moreno while we have him? Not seeing anything in chat, not hearing anything. Then that will conclude our media briefing. I just want to let all of you know that there's going to be a Monterey County wildfire recovery virtual meeting on Tuesday, September 22nd at 5:30. We'll be sending out more information about that shortly, but I wanted you to get that on your calendars. Thanks very much for joining us on the briefing today. Our next briefing is Monday. We'll see you then.
All right, bye, ma'am.
Bye-bye.